Thank you very much. In terms of testing for coronavirus, maybe specifically, because it's a respiratory virus, you would like to look at which type of specimen you need. That is very important because you want to have the type of specimen that will have the concentration of the virus so that you'll be able to get the right specimen to be able to do your right detection. So for the testing protocol that is being used, they have blood protocol, which have to do with collecting of blood, mainly looking at the serum. Like I said, if you're doing serology, you will definitely need a blood to get the serum. Now, the serum, what do we mean by getting serum? So to get serum, the process is serum is different from a plasma. So to be able to get serum, you have to collect the blood in what we call plain tube or red cap tube that does not have any chemical there to be able to accelerate clotting. So the blood will be able to clot, or a tube that have a what we call clot activator. It will allow the blood to clot going through the coagulation process. So if the blood clots normally, that is the blood will be able to contract, and then the clear yellowish fluid that you see on top of the blood once it is a clot, that is the serum. So the serum will definitely have what we call the is what you use if you're doing that blood testing. So what we use, for example, the protocol in Liberia, we for the swabbing, you have to collect a sample from what we call the nasopharyngeal. That is, you go through the nostril at the back of the nose, you'll be able to collect from the nasopharynx. So the nasopharynx region is, you will have to pull the swab through the nose and make sure you ask the patient to tilt the head gently at the back, so you'll be able to go through with a flexible, what we call a diaphragm or rayon swab. You go at the back of the nostril with that swab, gently rotating it and collect the specimen from the nasopharynx. So we also do two types of swab. The oropharyngeal swab has to do with collecting a swab from the mouth. You ask the patient to open their mouth, and then you will use a tongue depressor to press the tongue down and use a swab to go at the back of the wall of the mouth, and you go down a bit what we call the oropharynx. So the oropharynx is where you're going to swab to collect that. So the swab from the nasopharyngeal and the oropharyngeal swabs are put in what we call the viral transport media. The viral transport media is a specific type of media that favor the growth and preserve viral particles, and will also inhibit or stop bacteria or other organisms from growing in there. So what you want is, if there's a virus there or COVID specific in that sample, you would like to have that virus, to have the virus along there so it can be contamination, and then that medium in there where you are putting the swab, when you break it to put it in there for sending to the lab for testing, you want to destroy all other bacteria, so it will inhibit, it has growth factor in there that will stop the growth of bacteria and favor the viral particle to remain intact. So that is very important in terms of good sample collection, because the quality of the result will be dependent on the quality of the sample that is being collected. So in testing for virus, especially looking at virus like coronaviruses, you want to have a test kit that is specific. That means a test kit with a very high specificity and a very high sensitivity. These are two critical words in being able to select your test kit. So when you talk about, for example, sensitivity, you want to ensure that your test kit is sensitive, very sensitive, to the extent is able to uh, detect the presence of the organism that you're dealing with. So in this case, we are talking about coronaviruses. So you want to be able to detect coronavirus. Once you have coronavirus among different viruses in that specimen, you want the kit to be sensitive enough to be able to pick up coronaviruses. And what you also want to do is, you also want to be specific, looking at specificity. So if you have, for example, different coronaviruses there, you want a kit that is specific enough to be able to select COVID-19 from all other coronaviruses that are in there. So take, for example, you have flu, right? There are flu. You have flu, the common cold. So common cold, you have other coronaviruses and everything, right? So you want your test to be sensitive enough so that it's able to pick up coronavirus from among all other flu-like viruses. But you also want to ensure that your test is also specific in terms of specificity, so that among, maybe if you have different type of coronaviruses and flu viruses, it should go exactly and be able to detect COVID-19 from there. So that is very critical in looking at selecting a test kit in terms of sensitivity and specificity. Those are critical things to note. So, in addition to sensitivity and specificity to COVID, you also want to look at a test that is, you also want to look at a test that you will have to validate. So before using your test for particular diseases, you want to ensure that your test is validated, right? So if, for example, a manufacturer produce a PCR kit, say for coronavirus, they will send you the validation data, the QC data, and you have to do your own evaluation of the test kit. So every test kit that you receive in a lab, once that lab is a testing lab, the lab has to run what we call quality assurance on that. You have to run your internal quality control. So you will not just receive a kit and start using the kit. What you do is that you validate the kit in your lab, and the validation process entails that you have to take that kit and test again, for example, known positive that you have had, and you also testing against known negative. So this, for example, you know that this sample is already positive, right? So if you ran or known positive on that test and you start to get result, for example, that is giving you negative, or you ran known negative on that test and you start to get, like, for example, that you're getting positive, then definitely you troubleshoot that kit and you know that kit is not valid. Yeah, didn't pass QC. And once a kit does not pass QC, you wouldn't want to use such a kit in your lab. So for every test kit you receive in a lab, you want your lab to be able to validate and verify that that kit is doing what the manufacturer says it does. So that's a critical process of the quality control or quality assurance processes in the lab. So in addition to that, also, as a lab that is doing tests for COVID, you are required to take part in what we call EQA. EQA has to do with external quality and assurance. And in as much as you're doing external quality assurance in terms of participation, you must also implement within your own lab what we call I internal quality control, IQC. So you have to do internal quality control. So for every sample that you are running from a patient, you run a known positive and a known negative as control. So that's your internal control you run with every plate that you run for COVID testing, for example. So for every test you're running, if you are using on 96 well plate, that means you must have double controls. Some lab will run double controls. Double control means you are running two positive controls and you are running two negative control on every plate. So if you are using your 96 well plates, that means you have 92 well for which you will have patient sample, and the other four wells you will have two positive controls. That means known positive that you already know is positive, and you also have two negative controls, which mean known negative. These are tests that you already know. So the essence of running the internal control is that is a guidance, is a what we call a marker. So if you're running the plate, and for example that plate ran and your positive control, which also you know you put double controls that you already know is positive and is telling you that it's negative, it shows a signal that there is something wrong. Your positive control in terms of your internal control should always show positive. If it is showing you negative, it shows that you need to troubleshoot, there is a problem. You cannot trust that result. So your internal negative control will also guide you in terms of gauging your test in such a way that if you see your internal negative control start to show positive, it also tells you that, hey, there's a red flag here, you have to check. Something is wrong. So that result is invalid. You have to troubleshoot to see where the mistakes or the error is coming from. That is why in the lab, you always have to make sure these tests are done within a quality assured process. Thank you. So in relation to at what stage, the question about what stage of COVID-19 will be more active, it differs. So That is dependent on your immune system. The way the virus will treat an individual vary from one person to another based on their immunity. So your immune response will determine how whether you become asymptomatic or whether you are asymptomatic or whether when you get the virus within your system you will get sick. So there are some people that we've seen evidence have shown through scientific research that they have the virus in their system because the RT-PCR test tested positive, but they are not sick. They are not sick. We saw that typical in our country, for example, with Nathaniel Blama. In this case, so there are people that have different immune system. So that's why one of the thing in terms of supportive treatment for COVID has been supporting therapy that will boost your immune system or enhance your body for your immune system to be built up. So if your immune system is stronger, your body has a very good chance of fighting this virus. So that is also dependent on age because age is a very thing and also dependent on your personal habits in terms of whether you are a person that smoke, you're a person that drink, or you have or immune deficiency. So those are things that will determine whether you will come down, will be more active in you as a person or not. But once you have a healthy immune system and all of that, I think you stand a very good chance of survival, and your immune system is well intact to be able to or fight for against COVID virus. So the question that I'm asking in terms of accuracy of tests against COVID virus. So, uh, there are a lot of research going on. So we've seen that in the early stages when COVID came about, there were a lot of, for example, test kits that came about. So even you see that there are rapid test kit, there are serological test kit, and there are various in terms of variation in terms of RT PCR test kits that are available. So one of the key determinants in terms of what you're looking for is people want to look for test kit. For example, rapid test kits. Rapid test kits are good, but again, people will trend cautiously in terms of going for rapid test kit because of some of the things I talked about previously. You want to look at the sensitivity, you want to look at the specificity. I'll refer you to a typical or scientific evaluation of a kit that was taken to Tanzania. So you saw that rapid test kit was reacting to everything, even purple. If you take extract for purple, you put it into something, it reacted positive to it. So you saw that the test kit just tested positive for almost everything. So it's very good for us to train carefully when you're talking about rapid test kit. So rapid test kit, people look at it to be good, but again, you have to train carefully. People want to have a test kit that will maybe look at short time, 15, 20 minutes or 30 minutes, you get result. But what is the sensitivity? What is the specificity? I earlier on talked about sensitivity and specificity, so I'm not going to go back to that. But those are critical issues. You want to have a test kit that is able to reproduce in terms of result. If you tested a person now and it show positive, if that person is tested, for example, with a PCR, it should be able to indicate that it's positive. So if you tested that person with the kit and it show that it's positive, and you test with PCR, it shows it's negative. So you might be having false negative or false positive result when you're using a test kit, especially a rapid test kit that is not having a good sensitivity or specificity. So those are critical things to look at. So in terms of the PCR, so we trended carefully in terms of choosing PCR, and every lab will want to look at different methods in terms of selecting a PCR test kit. One is, what is it that the test kit is about? What is the science? What is the principle behind that kit? So take for example, they have different kits on the market that manufacturer have produced for PCR testing that target different portion of the virus, right? Other will go for the virus in terms of looking at the E gene. Other is going for other or testing for more than one part of the virus. So you checking for the E gene, you checking for other checking for the OFR, that's a component of the virus. Other are checking. So other are checking for 2 gene on the virus, and other are checking for 3 gene on the virus. So there are more sophisticated kits that we've seen from research that are being produced now than were during the early stages of the coronavirus outbreak. So a lab will want to look at the data and be able to get a kit and test the kit against existing kit that they are using. Like I mentioned earlier, looking at the validation process, you want to see if what the manufacturer says what is working. So you will test it against unknown positive or known negative and look at what we call the sensitivity and the specificity. So you will be able to make a decision to say, yes, this test is sensitive enough for me or for my country or for my lab. We make a decision based on this technical data that we are seeing to use this kit because we feel that this is good kit for us. So maybe this is a 3 gene kit. It's very good for us and we trust it. We think we can work with it. And other will also look at it in terms of the platform. Do you have the platform that this kit has been validated on? That is very important. So some of these manufacturers, they do the test kit and they say they validate it, for example, on the ABI, the Apply Biosystems. So others will do it and say is validated on the Roche. So the Roche or life cycle PCR machine. So you need to look at what do you have and the kit what it was originally validated on. So if you are using your machine or PCR machine that particular kit was not validated on, definitely you don't expect to have that. And in case anything go wrong, the manufacturer already told you that this is the machine that we validated this kit on. So it's always good to go for platform that have been validated on the type of PCR machine that you have in country. So that is very important because that will guide you, and then you have been given a guarantee in line with the QC data you receive from the manufacturer and also from your own analysis from what you have done in terms of internal control and looking at your own validation process. So those are very important things to look at in terms of looking at test kit and how effective they are in terms of trusting the results. So I want to address the question that referred to why is it that important to test dead body. I think this is a critical point, and this is where we have been able again as a country in Liberia to share our experiences with the sub-region, and other countries have followed us because we lead and they follow. So it's a very good thing to be able to test people that die because it's the only chance you have, for example, to be able to confirm whether that person that have died actually died of a coronavirus. That's one. And the second point is that if that person tested positive or that body tested positive, it's going to give you a clue in terms of searching or looking at the profile and line listing contacts of people that are living that could be able to possibly spread that virus to a lot of people, a lot of family members, a lot of people in their community, a lot of people at their workplace if follow up is not done with those contacts. So probably they might not have even knew that that person or had a virus and that person was shedding the virus and that person have died. So it's a very good thing to test the body because if the body tests positive, it gives you a clue to be able to follow up on contacts. And once you have follow up on that contacts and get them tested, you will save the public in terms of breaking the transmission dynamics, the chain of transmission within the population. So one dead person could be able to transmit that virus to more than 500%. If those contacts are not follow up, those contacts will not be contacts of other people in terms of spreading the chain. Imagine if that person that had died came in contact with 50 persons and those 50 persons they were not follow up and they had contact with other 50 or 150 persons and those other 150 were not follow up, and suddenly you will see that just from that one person, if you should do the epi tree, you will see that that one person will go up to even causing the spread of the virus in more than up to 500 persons. So it's very good to test the dead because you get a clue and you are able to follow up on contacts earlier. You are able to inform people, you are able to isolate those contacts and definitely break the transmission chain within the population. So in public health, we always want to break the transmission chain to be able to save the general population. So that's why it's very important for us to test people that die to know if they die from coronavirus or not. If it's not corona, if the test is negative, we allow people to take their body and do the burial. But if it is positive, then you have to make sure you do safe and dignified burial with the family, and then follow up on possible contacts to be able to see the general population. I think that is very, very important. So, it's a very good question you asked, Actor, in relation to different strains of COVID. Yes, we are having the virus is mutating, and it's not something that is strange. Like many RNA viruses, we know that mutation is very, very common in viruses. So the virus will change its genetic makeup from one point to another. So what we do in the lab or in the scientific community, one of the means by which we do this is that you will always have to follow up with the virus because it's critical to have a primer. Now, in PCR testing, we use primers and probes. These primers and probes must be specific to be able to detect the virus looking at the viral genetic makeup in terms of the genome sequencing. So one of the things that we do to be able to follow up this in the scientific community is by doing what we call whole genome sequencing. So we sequence the virus. What do I mean by sequencing? In sequencing, you will be able to break down the viral DNA in terms of mapping up the viral genetic makeup. So you map up the viral genetic makeup, for example, from our first case, which are our index case, and then follow up in terms of sequencing other cases that came from that, and then form or what we call, or you can be able to form what we call the pedigree. You can form a tree that will look at from the index case to the cases that's only what's the difference, how has the viral changed from the first case to case 500 that we have now. So that is very important in science because it will now give you a clue in terms of how fast the virus is changing. For example, from the first case for the first 200 case, how the mutation was, what was the sequence of the mutation. From the 200 case to the 500 case, how fast had the virus changed in the genetic makeup. So those are things that will guide you in terms of preparation of primers and probes that will be able to detect if the virus had changed, to be able to detect mutation in the virus. And we have done that with a lot of viruses. Take, for example, we've done that with Lassa fever virus. So we published a paper on in Lancet. If you look at it, you can check my PubMed, you can check my PubFat, you can also check my ResearchGate page. You can see a copy of that paper there. So we're able to look at Lassa fever and then from as far back as the 60s and compare the strain of Lassa fever that we're having today in, for example, 2000. So that has shown a clear genetic map in terms of how Lassa fever has changed over the years. And I also did that in my PhD research with what I did with TB, looking at drug-resistant TB. So I was able to do a genetic sequencing in terms of looking at the genome of TB over the time, though that's a bacteria, but just to share that, you can also see that people are published that with Nature in microbial genomics. You can check my page. If you Google John Dover, you will see it. It's part of my publication. And that, the latest version of that was just published in January of 2020. So you can see that that was published in Nature. So you'll be able to look at the genome of the virus in terms of the sequence of the virus over a period to see how it has mutated. So for example, with the one with TB, I was able to really look at that in depth in terms of even looking at the strains that have been responsible for drug-resistant TB in Liberia, and even looking at the origin in terms of tracing the origin to see where they came from or where they might have come from. So when you get these strains, when you have done the sequencing, you can compare with other strains. For example, in the gene bank, you can compare with strains that came from China, strains that came from the US, and see and possibly find a linkage. The strains in Liberia, where they possibly might have come from, are they directly related to the ancestral that came from China, or are they related to the one that went to the US, or are they related to the one that is circulating in Europe? So you can find a genetic link and link these in terms of the genome sequencing. So those are very good things that we do, and that is very helpful in terms of looking at what primers and probes to be able to to make to be able to detect these viruses. So that's another important point that I wanted to share. Now, it's very important, like I said, uh, with the test that we're using and the detection limit, for example, you might be able to test, for example, the person, the incubation period they are incubating, right? So if you collected a sample and you did a test, there are sometimes for quality control purposes, like I mentioned earlier, you did the test and then, for example, the positive control or the positive control or did not read, right? That's your internal control. So if the positive control did not read or is reading negative, definitely it tells you that that whole plate has a problem. Or the negative control is reading positive, it tells you that you have a problem. So that means you have to re-extract. You have to do a different extraction of the samples that you have and set up a different plate to run on the PCR. So you might have to do your internal control to make sure, because the essence of putting result is not just because you want to put results. You want to put out results that are reproducible, results that are realistic, results that represent what comes from the patient. So if you have a situation wherein you did an extraction, you set up a plate, and yes, you have 92 specimen on that plate for patients. You have your full controls, two internal control for positive and two internal control for negative, and you ran that plate, and there's contamination of that plate where you see your positive control, for example, did not amplify, or your negative control did not amplify. Definitely, if your controls don't pass, you cannot validate that test result as positive or negative. So you have to rerun that test. So there are even times when they run the test and the results come based on the CT value, even if it's positive, the quality manager or the director of the lab have that right to look at the result and look at the CT value and say this test go and repeat. That is it. That's the check and balance that is within the system with the quality management system that is in place. And that is very important, where you can troubleshoot and look at it and say, yes, this is saying this, but that was make you a technician. A technician look at the system and look at the machine and detect machine error from human error. You are not just taking everything that comes from the machine, because you know, or you set up the parameter in the machine, and you should be able to detect where you think that there is flaw that you need to be repeated. So you can have a positive over RCD value. You say, no, this one you have to repeat because I want to see if it will come out clean, and I want to see if there will be variation in the CD value. So that is very important to consider. So is yes, it's possible, and there might be also time that you do the test and it's indeterminate. Indeterminate means that the machine is telling you the detection point is not detected, so it cannot tell you whether it's positive or negative. So in that case, you have to collect another specimen and do another extraction to be able to see. So that might be maybe you wait 1 or 2 days and collect specimen and do another extraction to see. So that is very important. So that's part of our quality control process in terms of our quality management system, to be able to cross-check, to know when to check the system to see. There can be time you do the plate and abnormally you see, if you're running 96, 92 samples, you see about 60% of the sample on the test showing positive. You have to troubleshoot to see if it is actually a true positive or false positive. So that's where you will be able to detect, and you want to cross-check to dot your T's and cross your I. And just as you do in journalism, you want to follow up with a story to make sure it's right before you publish. So in the lab also, you have to follow up with the quality management system to make sure everything is good before you put out the result. Thank you. It's very good to do your COVID-19 testing. It's very important because you don't have to be sick before you do it. You don't have to be a high risk contact before doing testing for COVID-19. It's important because if you do your test and you get positive, and at the early stage you have a high survival rate. And like we've seen in Liberia, for the cases that we have had so far, we have a very high survival rate. People are getting killed when you go to the ETU. Those that we see that are dying are people that presented very, very late at the ETU. They were sick, they stayed home, they started to first self-medicate, and by the time they came to the treatment unit, it was late. They already came very, very sick and all that. So some of them even died before entering the treatment unit and all of those things. So if you get tested, you know your status, and you are sick, you get to the treatment unit, you will be taken care of. So the good thing about going to the treatment unit is that they will look at you, they will monitor you, they will look at your temperature, they will do your vital signs, and if there is changes in your vital signs, they will be able to provide you supportive care in line with what is happening to you. So they're not going to give you treatment for this, or that. There's no special treatment. So they're going to give you supportive care in terms of what they are seeing from the vital signs. So that is very important. It's very important. We are encouraging people to go and get tested, and encouraging people to look up in their communities. If people are sick, you encourage them to go and get tested. So it's not something to hide in terms of if a person is a contact, you should be able to report that to the health authority, because if you keep that, that person has the potential to spread that in the community, and your children might be infected. You say you will be exposed directly or indirectly. So it's very important for us to come forward and for us to be willing to show ourselves if we are contact, or even if we are confirmed. Yes, that is very important for us. Thank you. Currently in our country, Liberia, you have several sample collection sites that you can just walk to and or get your sample collected for testing, and you get your results within 24 to 48 hours. So I'll just name some of those sites for you. If you walk to the SKD School Complex, they have a testing or sample collection site there. You can get your sample collected and you talk to people when they get a sample collected and sent to the lab for testing. And right now on the Dupo Road, we have a open sample collection or mobile sample collection site on the Dupo Road to collect sample from people that want to get tested. And on at Tubman High School on 12th Street, we have sample collection site there to be able to collect sample from people that want to get tested. At the GW Gibson High School, there is also a sample collection site there to collect specimen from people that want to get tested. So you can walk in at any of those sites that are convenient for you, and there are other sites that will be coming up soon. The sample will be collected and sent for testing, and then your results, you'll be called and given your results. So the process is simple. You just walk there and you'll be directed by the attendant at the site to tell you what to do, and your sample is collected, and that's it. So in terms of confidentiality is one of the highest thing when it comes to medical ethics in terms of laboratory ethics. So you is the technicians at the lab, the first thing is that they sign a confidentiality bond. So a confidentiality bond means that you cannot breach any confidentiality in terms of what you have. And the system will not allow for that because of the check and balances in the system. Those that go to the sample collection site to have their sample collected would know that. Because when the samples are collected, the data is entered, is coded, and then it goes to the lab system, and then they receive the specimen with numbers, not your name. They are not getting your name, they are getting your number, the code is on the specimen, and they use that specimen on the lab or worksheet to test. It's not name that is going there, it's the code. So when the test is done, it goes to the data team. The data team will enter the data into the database, and that database, once it's entered, the result is sent to the protocol, the approved protocol for disbursement. It's not a lot of people that give out the result. You have a special team, the psychosocial team, that will call to give out result because they are trained to be able to counsel people to give results. So it's not the lab technicians that are giving out results. So that's the system. So if a lab technician is found to breach that protocol, you'll be sorry for yourself because the first thing your license to practice will be revoked by the laboratory board and lab association. If you don't have a license, you cannot practice laboratory in any country. So that means you are killing your profession for that. So once you are caught in such an act, your license will be revoked. If you don't have a license to practice, you cannot practice in any or wood lab. So that is the principle. So people sign confidentiality bond, and they have to respect that. And so I just want to thank you for inviting me. It has been a pleasure to share my experience with you. Please feel free at any time to call me, and I will be able to come to share my knowledge and be able to learn from you also. Thank you very much. It has been a good experience. Thank you.